It was 35 years ago that Lucille Packard stated that she had a dream of creating a hospital that would nurture both the body and the soul of children in need. And indeed, for over 30 years, Debbie has nurtured the body and soul not only of her patients and their families, but also nurtured the institution itself, who, along with the other recipients of today's award, nurtured the institution through a fragile infancy, a rocky adolescence, to become the amazing institution of caring and learning that it has become today.
In 1991, as we were preparing to open the new facility, Debbie joined the faculty at Stanford as our lone pediatric ophthalmologist. During the next 19 years that I worked with her, she developed a pediatric ophthalmology program, which was second to none. She took a program that was really non-existent prior to 1991 and developed it into a world-renowned, preeminent pediatric ophthalmology program, recruiting additional faculty, training further residents and fellows in the field of pediatric ophthalmology, and she is the national and international recognition for her efforts in this area.
Well, Debbie Alcorn is a unique physician. She's a super subspecialist and she's a general physician. You'd think that as a pediatric ophthalmologist, her focus would be pretty narrow. But Debbie knows her patients from their eyeballs to their toes. She does this by a casual conversation style of probing, and she learns everything she can about the patient, their siblings, the family, and by having this intense knowledge of the patients, she's come up with some amazing diagnoses and treatment plans and strategies for some of the most complex patients in the organization. So she's unique in that way, I think, as both a super subspecialist and she becomes a general physician.
She did this by service not only to her patients, but by service to the institution, serving on just about every possible committee somebody could serve on, but always being the person on the committee that gave voice to the few other women who were on the faculty in those early days, as well as giving a voice to those whose voices were not often heard.
Debbie also strove to be an outstanding clinician and educator of the medical students, residents, and fellows in pediatric ophthalmology. In addition to her role in the Department of Ophthalmology and Pediatrics, she is also instrumental in the care of critically ill children who had complex eye issues, and she was very, very available, always providing insightful comments and helpful input into the care of these complicated patients.
With that in mind, her clinics are long. And at 6 or 7 p.m. when her clinics are over, she goes across the street and staffs inpatient consults with the ophthalmology residents. And she does this not only because of her dedication to the patients, but her dedication to the training programs in both ophthalmology and general pediatrics. And I think most of us have learned so much from Debbie by these consults and her interactions.
Shining is indeed the operative word when you're talking about a superstar. And what makes her shine is her ability to take something simple like this, a retinoscope, an old tool, not unlike you and I, Debbie, that few still know how to use. But with this tool, we can shine a light into the eye of our patients. And by seeing the way that light is reflective, know how well the child sees. And she's spared hundreds of children from unnecessary surgery by her skill at being able to retinoscope, her skill at being able to give a pair of glasses, her ability to tell a parent that indeed your child can see and we can make them see better.
Debbie has given probably more lectures to the pediatric house staff than any pediatric faculty member has over the many years that she was here. And I've had the opportunity to travel with her to various conferences that we put together both at Packard and in San Francisco. And Debbie was always a highly demanded speaker at these conferences, and thus I invited her as often as I could. And with the conferences come social hours, and during these social hours, many of the pediatricians would come up and talk to Debbie about referrals, concerns they had with their patients who had eye issues. But more importantly, when we would go out for dinner families who lived in far-off counties, Napa, Sonoma, even locally in Palo Alto, would spot her and come up to her as we were dining and thank her enormously for the care that she provided for their children. She made it very clear to everybody that she took care of the child and was able to make the child see better so they could learn better, and the families were very grateful for her contributions to their children's well-being.
When I'm asked to recall a story that characterizes Debbie, it's pretty simple, and it's multiple stories. And it usually involves one of the 100 beautiful sunny Saturday or Sunday afternoons when I was on call and called to the hospital to see a child with orbital cellulitis or perhaps shaken baby. And I'd pull into the parking lot at 730 Welch Road, and there I'd see Debbie's old blue BMW. And I'd go into the clinic to pick up my equipment, and there would be Debbie speaking to a family, finishing her notes, getting ready for a lecture. And I'd often see Bill Kennedy doing the exact same thing. And I'd say to myself, what's wrong with these people? Don't they have any life? Well, and I soon came to learn that their life couldn't be any fuller. Because what they have done and what they've dedicated their life is taking the hopes and fears of her patients and their families and placing that burden upon their backs. And by doing that, have made the lives of her patients and their families much better, the burden lighter. And in fact, nothing could fill a heart more fully.
She does not like Deborah. She doesn't like Deb. She's Debbie.
She has been a tremendous leader in this field and has provided tremendous insight into the care of patients with complex eye issues and complex medical issues.
I feel fortunate that I've known her in all of those roles, but also in the role as good friend. And Debbie, if she's your friend, you have a good friend. So I think for all those reasons, Debbie is most deserving of this award.
I want to say best of luck to Debbie as she goes on to the next chapter of her career in her life.
I feel fortunate to have been able to work with you for so many years and congratulate you on this well-deserved award and distinction.